Alright, so we have a patient, Mia. She is 46 years old. She is an at-home seamstress. She's coming to us with right-handed pain, tingling, numbness.
Hello.
Her birthday is August 26, 1967. And she's Caucasian.
Yep.
This is deceiving. She's Caucasian. And the following is our
I'm also female.
exam and our evaluation.
Alright.
Alright, so Mia, I seen on your sheet that you're coming in with some right-sided hand pain.
Yes.
Can you tell me a little bit about it?
I just have a tingly and numbness feeling on my right hand, just especially after work.
After work?
Yeah.
Okay. When did you notice these symptoms, I guess?
Mainly, especially after like a heavy workload day, and then just my hand starts hurting real bad. But it's been going on for at least 2 years now.
Oh my goodness! So you've really been dealing with this. Where exactly in your hand is it? Like the whole hand? Is it?
It's mainly part of where my thumb is, and then to my middle finger, and it's right here.
It's right in there.
Yes.
Okay. Has the pain been getting any worse? Getting any better? Stay the same?
It's pretty much stayed the same, yes. Especially worse at night. I've been waking up.
Okay.
During the night.
And do you have to do anything for it? Like?
Sometimes I just shake out my hand just to release some the tingliness.
Okay. That seems to help?
Yeah, that seems to help a little bit, yes.
When you said this happened 2 years ago, did anything specific happen or just kind of came out of nowhere?
No, no injuries or anything. I didn't have any trauma to it, no.
Okay. And you said it's like a numb, tingling
feeling,
like that?
sensation, yes.
Okay.
Sometimes it's really weak as well.
Okay.
I'm unable to grip things.
Okay. If you could grade the pain, 0 being no pain experience, 10 being the worst pain you've ever imagined, what would you grade it?
A 3.
Okay. And at its worst, what would you say it is?
An 8 out of 10.
Okay. And then on average, maybe?
Like a 5.
Okay. And how often would you say you experience this pain?
Pretty much every day.
Every day?
Yeah.
Okay. And you said you especially notice it after you're
working
and
a
stuff,
lot, and then also at night when I'm sleeping too, yes.
Okay. Does the pain seem to refer anywhere, or does it just kind of sit? Does it radiate?
It goes down to the tips of my fingers.
To the tips of your fingers?
Yes.
Okay. Have you ever had any previous traumas or anything like that?
Mm-mm.
No? Nothing? Okay. You've never previously hurt your wrist or your hand, arm?
Not that I know of, no.
Okay.
Sewing is pretty easy. I mean, it's not heavy or anything, so I just don't think I've ever strained it or anything either. No.
Okay. Have you seen any other healthcare providers for this? No? Alright. And aggravating factors you said would be using your hands more and just increased workload?
Yep.
Okay.
Pretty much any type of motion and movement and such. I've been having trouble with reading the newspaper, crocheting, doing hobbies and stuff, painting and typing. It hurts.
Alright. Does anything seem to help it?
With rest and ice, it does help it.
Okay.
For 10 to 15 minutes.
Okay. Have you done any other self-treatment?
If that by you mean take anything, I have been taking ibuprofen.
Okay.
Every 4 to 6 hours when I have pain.
Okay.
I do take that.
Do you notice any relief with that?
Relieves a little bit, but not too much, and it still comes back again. Yes.
Okay. And then, do you notice any other symptoms like lightheadedness, nausea? You said weakness, right?
Yep.
Okay.
So that was pretty much it. Just,
That was okay.
Yeah, a loss of power in my right hand here. Can't be able to grip things very well.
Okay.
Tightly.
Okay. Have you ever had any accidents or surgeries?
No.
Okay.
No, not that I know of. No.
What about your family history? Any major illnesses
My mother was diagnosed with diabetes too.
Okay.
When she was 32.
Okay.
And she recently passed away, and she's 65 years.
Okay. Do you know about the treatment that she received?
No, I am unsure of what the treatment she
Okay.
received, so I don't know what was going on with that. No.
Okay, that's fine. Do you take any other medications besides the ibuprofen, or any supplements maybe, or anything like that?
I do take one a day, women's multivitamin, and ibuprofen as needed and stuff, and like fish oil once in a while.
Okay. All right. And then, what do you like to do for leisure?
Like, I did mention that I do love crocheting
Mhm.
and sewing.
Okay.
I do like just doing various crafting and stuff. Yes.
Okay. What would you say about like your lifestyle? Would you say that you maintain like an active lifestyle, that you eat a balanced diet?
I believe I have a well-balanced diet.
Okay.
Well, look at me, I don't smoke or
Okay.
anything. I do drink alcohol occasionally.
Okay.
Glass of wine here and there.
Okay.
And then sometimes I am very stressed due to like the increased workload of sewing and
Yeah.
everything, and getting like the clothes done on time.
Okay. When you're working, like, what kind of a position are you in with your body? Like,
Well, at sewing, I'm always crouching over,
crouched over and sitting.
sitting and stuff. My hands are always like in wrist
Okay.
motion, like my wrists are twisted.
Okay. And how long have you had this job?
For a very long time now. I believe I started when I was very young, maybe 16 years, 25 years.
That's a very long time.
Yes.
All right, I think that's all for our history. So right now we are looking at the DDXs of carpal tunnel syndrome, thoracic outlet syndrome, cervical radiculopathy, Pancoast tumor, and median nerve entrapment. We're going to move on to the exam. Our patient is 5'2", clearly
No, I'm not.
135 pounds, and as stated, she's 46 years old. She has a lean build, normal gait, and with restricted upper body movement, probably to guard like the pain that she experiences in her hand. And she carries her head anteriorly, and she has rounded shoulders,
Yep.
like an old woman. Okay, so next with our exam, we're going to move into just some range of motion. So I'm going to be checking your neck. If I could just have you let me know if you experience any pain, discomfort, anything that you out of the ordinary, okay? All right, so we're just going to turn your head.
Ow.
Ow, okay.
Ow. Yep.
Ow, okay.
Literally.
All right. We're going to flex your head forward.
That hurts.
Okay. And then we're going to go ahead and extend it back.
That hurts too.
Okay. If I could have you bring your ear down and touch this shoulder. All right. And then bring your ear down and touch this shoulder. Okay. Thank you, ma'am. So as you can see, that's very, very restricted. Also, the range of motion that you would see restriction in would be, if I could have you flex your fingers. All right. Those finger flexors, those are going to be weak. And then also if I could have you curl your wrist down. Okay. And, okay. And then extend it back for me.
Yep.
Okay.
Hurts.
All right. So that is all very painful. So with your finger flexors and all wrist movements, I guess, are restricted and painful. Next, we're going to move on to muscle strength. So we're going to look at you would obviously do the left hand first to test strength. We know your time is very valuable, so we won't do that. We're going to move right to the problem one. And we are looking for like the pinch grip strength. So we'll, if I could have you, yep, perfect. Don't let me pull apart. Oh, problem.
Finger problem. Yep.
All right. Actually, you experience pain with all of those?
Yeah.
Okay.
Well, mainly these fingers.
Those ones are there. Okay. And you'll also notice her thenar muscle is very atrophied and just.
Hypertonic, yeah.
All right. I'm just going to go ahead and feel around in your wrist. Let me know if you experience any pain. Okay, we won't go any further. So, wrist is tender upon palpation of like the wrist and the fingers. All right, what we're going to do next is some sensory testing. I could have you, yep, just like that. And let me know if you feel a decrease in sensation from either side.
I can't feel the right side.
Okay. So from here you would do the pin test, which we don't have a pin. So.
Hearing.
Okay. So this is dull. This is sharp. Can you tell the difference?
Yeah.
Okay. If I could have you close it. Oh yeah. Sharp. Can you not? This is dull. Can you tell the difference?
Mhm.
Okay. So once again, you test the left side first because it's good. We won't do that. Normal over there. Good job. Move over the problem side. Okay. Close your eyes. Let me know if this is sharp or dull.
I can't feel that. I don't know. I don't know.
All
Sure.
right. So there's sensory loss to pinprick. Thank you, ma'am. Also, to light touch and 2-point discrimination, there would also be decreased sensation. The reflexes of the median nerve are going to be decreased, and next we're going to be doing some orthopedic tests. So first, if I could have you match the back of your hands up like this, and then go ahead and push down like that. Yep. Any pain with that?
Yeah.
Yeah? Okay, where is your pain at?
Just along.
In like the same spot?
Yeah.
Okay.
Right here.
Alright. Next we're going to be doing the test called reverse valence. If I could have you with your praying, and then have you push down with your hands. Does that cause pain?
Yeah.
Okay.
So along the side too.
That same one. Okay. Next we're going to be doing Tinnell's tap test. Does that cause pain?
Yeah, that hurts right there.
Okay. And then we're just going to be, we already said palpation hurts, so technically we wouldn't have to do carpal compression, but we said that's painful. These are suggestive of carpal tunnel syndrome, and that is our diagnosis. Our treatment plan for this is we would do some adjustments after we have iced the area to reduce any pain and inflammation. We would adjust the scaphoid, the triquetrum, the hamate, and the trapezium P to A, and then we do an A to P lumate, trapezoid, and capitate. We would not advise doing any soft tissue as the area is very sore and tender. Immobilization, it'd be nice to restrict her activities even though she is a seamstress, so that's going to have an effect on her job. But any way she can, maybe like educate the patient. She said she has problems sleeping at night, so if we can just, you know, help her figure out some positions to help with her like wrist and to avoid just that excessive flexion. She can also wear a splint at night. To help with the pain, we're going to do some ultrasound, some ice, some electrical stimulation, and just some conservative stretches and exercises to really strengthen and stabilize the muscles in the area. She said she has a balanced diet, so we're going to maintain that, and we're also going to incorporate vitamin B6 and omega-3 fatty acids into our diet. And if these conservative measures fail after 2 to 3 months, carpal tunnel release surgery is a possibility, but we'll assess that when we get there.
Yay!
Yeah.
That was extra credit.